Hello, my name is Lulu Nwaladi. I did my presentation on obstructive sleep apnea in adults. Our learning objectives will be to identify what sleep apnea is, discuss the different cognitive deficits, identify areas that are affected, identify how depression and OCA are related, and be able to discuss CPAP therapy. What is sleep apnea? So there are two types of sleep apnea, central and obstructive. Obstructive is the more common type, and basically this happens when the pharyngeal muscles relax, the airway collapses, the upper airway. So during sleep, an apnea episode occurs and breathing halts. This basically makes oxygen levels reduce and carbon dioxide levels then escalate. Sleep fragmentation also occurs where OCA patients will awaken momentarily multiple times during the night, and their REM sleep and deep sleep stages are disrupted. The sympathetic nervous system is also initiated. So there are multiple cognitive deficits that occur. One being executive functioning, so being able to make decisions and plan for OCA subjects is harder, basically because of damage to the prefrontal cortex. When it comes to the prefrontal cortex and the hippocampus, we see reduced gray matter volume, so this means neuronal loss in those areas. The brain metabolism is also altered. In specific areas like the left hippocampus, the N-acetyl creatine compound ratio is increased because of the decrease in only the creatine compound. And basically what this means is that when we see OCA severity and cognitive performance, when they're correlated, correlated as being worse. And cortical gray matter, it becomes smaller in OCA subjects, as well as the right hippocampus, right and left caudate. And fMRI shows also less brain activity in areas such as the left post-central gyrus. We also see impaired attention. So there's limited focus all at once for OCA patients, and this has been found in about 95% of them. There have been tests to prove this poor performance in contrast to the control groups. So this being tests such as maintenance of wakefulness, sustained selective and divided attention. And then this impairment can also affect other cognitive functioning like episodic memory. When it comes to memory, so we know for sure is that working and long-term memory are impaired. And also working memory is slower because of the lack of activation in the dorsolateral prefrontal cortex. We also know there are deficits in episodic, procedural, and working memory. However, when it comes to discussing certain episodic memory like verbal and visuospatial, different studies say that one is more affected than the other, or one is not affected at all. And only one of these is affected, one of these episodic memories is affected. So these findings are still inconsistent to show how correlation between OCA severity and deficits of memory, how they are by nature. So we definitely do need more neuropsychological testing to view cortical and cerebellar areas to show this. When it comes to OCA and its relationship to depression, so OCA is a big risk factor for depression, and why this is because hypoxemia escalates processes which destroy the brain, so increases neuroinflammation in prefrontal cortex, gray matter is lost, white matter lesions are created. OCA is preventable, but it goes undiagnosed. OCA also has a very undetermined connectivity to depression. So they are both very highly associated with each other. One can trigger the other, but still pathways of connectivity remain undetermined. However, we do see that sympathetic nervous system that we've talked about previously is initiated. So depression does occur because of the high cortisol levels and the stress that increases because of this. Some fun facts also, as of 2016, 22 million Americans have sleep apnea. 80% of men and 93% of women that have OCA are not diagnosed. CPA treatment. So CPA treatment is one of the more popular treatments when it comes to sleep apnea, which is the continuous positive a positive airway pressure, and this helps maintain positive pressure in the airway. It definitely requires a generator, a nasal mask, and pressure delivery tubing. So this is a machine basically. With the use of CPAP, however, we see that depression has improved for patients. So patients have depression drops from 74.6% to about 3.9% after 3 months of use of it. Working memory, however, as we've talked about memory previously, there's still inconsistencies when it comes to seeing how well a working memory improves. However, executive functioning was not affected after treatment with CPAP. And then these are my citations. Thank you.